Are topical estrogen creams the secret to youthful facial skin, or are the risks simply too large to ignore? Today, we're gonna look at the science and we're gonna help answer that very question. Hi everyone, I'm Dr. Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of KaramMD Skin. And on this episode of Skin School, we're gonna look at this very important and very popular question. Many of you have asked me, should I be using estrogen creams on my skin as a principal way of defying skin aging? We're gonna look at the science behind why estrogens would be potentially used. We're gonna look at the consequences, the risk, but more importantly, the possible contraindications that are very, very important to know before you endeavor down this road. In addition, ultimately, I'm gonna share with you what I consider to be an alternative method to the use of estrogens in the overall approach to anti-aging. Let's start off by understanding where is estrogen generally used in the role of aging. The medical uses for topical estrogens have primarily been around the use for vaginal dryness, thinning, painful sex, as well as bladder-related issues. And somewhere along that continuum, we've begun to use topical estrogens as a way of improving the quality and the youthfulness of skin. And it makes sense, and here is why you would want to consider this and why people have been doing this. Number one is there's a direct relationship between estrogen and collagen. And really at the end of the day, the loss of collagen over time is what results in skin aging. It causes skin to thin, gets fine lines and wrinkles, the dryness, overall texture, all of that is related to collagen. And as a structural protein, its number one input to stimulate it comes from estrogen. So when you follow the collagen estrogen curve over life, you see that they follow each other. They literally run in parallel. Somewhere in the mid-20s, the estrogen level begins to diminish, and so with it, so does collagen. Things are going pretty slowly until they get to perimenopause and menopause, where suddenly it goes very, very quickly. And that sudden drop of estrogen followed by collagen is what gives the skin the aged look. And that correlation between those two is the reason why topical estrogen creams have become considered as a skincare approach. The reason follows, if you can increase the amount of estrogen that the skin sees, well, then it's gonna stimulate more collagen, and as a result, the skin is gonna look more youthful. So what does the science show? Skin does look better when you're using topical estrogen. It looks a little smoother, fine lines and wrinkles improve, hydration improves, all the things that make skin look more youthful, more supple, etc. So it's natural to conclude that this would potentially be a viable addition or a replacement of skincare. However, keep in mind the majority of the studies, which is quite frankly very, very small number of studies relative to the overwhelming abundance of studies that have been done over a 40-year period with ingredients like retinols, vitamin C's, hyaluronic acid, peptides, etc. There's a relatively small body of research that has been done, mostly in the 90s and a little bit in the early mid-2000s, that study this topic. And none of the studies have been very, very well designed or large enough to really pull strong conclusions with them. The majority of these studies have been very short term, meaning weeks to months. None of them have followed patients over long periods of time, and none of them have really been designed in a way that you can pull information about side effects, etc. And many of them have been mixed in terms of their side effect and potential health-related consequences, measures, and outcomes. The logic of using topical estrogens is that if you're decreasing systemic or blood-borne estrogen levels as a result of aging, that if you use it topically, you don't necessarily get exposure to full-body estrogen, which can be potentially dangerous. It essentially becomes hormone replacement. I'm gonna get more into that aspect in a minute, but if you think about it, what you really don't want to see happen is that any of that estrogen is being absorbed enough to where it would cause any systemic hormone-related effects. And what you actually do see is that in a number of the studies, there is some evidence that it is being absorbed into the general system. So things like breast tenderness that can come from systemic estrogen levels, spotting can be seen with that. And these are the things that lead to the observation that perhaps topical estrogens are not necessarily being confined to the skin. And the other aspect of the studies that haven't been clearly shown is what is the dose of topical estrogens that really should be used safely. So now let's open it up a little bit to the safety issues, the pros and cons of this. So on the one hand, the pros, certainly The estrogen interacts with the estrogen receptors in the skin, leading to a downstream effect causing increased collagen, increased hydration, youthful looking skin. I can easily believe that, and I think there's enough empiric evidence, meaning that people who've tried it vouch for its results. However, this is very important. If you want to highlight something about this is what you want to highlight. If estrogen is being absorbed into your bloodstream, even in small amounts, number one contraindication is if you have a propensity, a genetic propensity towards breast, ovarian cancers, for example, that are estrogen receptor positive or sensitive. These are strong contraindications. So if you have this, you shouldn't be on any type of estrogen-related hormone replacement therapy, etc. These are all the things that we learn about and talk about when considering hormone replacement. So here you are on one hand thinking, hey, I'm gonna do something really positive and nice for my skin. I'm gonna subscribe to some online estrogen cream. You don't go out and get fully assessed and tested by your personal physician, get a good family history, get a good genetic testing, because the fact is many of us don't even know what our genetic sensitivities are or what we have a propensity towards. The reality is this requires careful medical evaluation before you're using it, but also it requires ongoing medical evaluation because no one knows what happens to the body when you're on topical estrogen for a long period of time. This is something that is critical to the assessment of whether or not estrogen treatments for your skin make sense. And I want to also make a point about newness. Like I said, there's been studies that are published in the 90s, handful. Nothing has been done recently. Also, if it was such a panacea and something that was so valuable and worthy of use, why wouldn't have it been used? We're 20, 30 years later and it's still not commonplace. That is a little bit suspect to me. And I think, again, every time we evaluate these type of things, we have to look at the risks relative to the benefits. We already talked about the benefits. Now the risks, they're real. And those are things that you have to definitely take into consideration. Another risk that happens with unopposed estrogen is endometrial hypertrophy, meaning that the internal lining of the uterus gets thicker. Unopposed estrogen, meaning without progesterone, like you see in most birth control pills and hormone replacement therapy, can have that effect. The other one, in rarer cases, but definitely in people who are susceptible, estrogen has an increased risk of blood clots. So you see people getting DVTs, which are deep vein thrombosis. So you go on a plane, potentially have a blood clot, God forbid, a pulmonary embolism as a result of that, et cetera, et cetera. So these are definitely all things that are related to estrogen. And since we don't know the dosing that goes along with it, and we don't know the long-term safety profile, it puts us at risk for these type of things because many people don't even know if they're sensitive to those, as I mentioned. The other really important aspect here, and this is something that would worry me and scare me, and when I talk to my dermatology colleagues, this is what comes up a lot in addition to the things that I just shared with you, is how do you, as a physician who orders this topical cream, how do you know that the patient is using exactly how much they're supposed to be using and they don't get overzealous with it, right? I mean, you can imagine how easy this is. Like, oh, more is better. Oh, I'm gonna put some on my chest. I'm gonna put some on my neck. I'm gonna put some on my hands. You can see how that small amount that you're supposed to put on your face to hopefully keep the hormone levels below, a unknown safety level suddenly becomes well above, right? Because people take it into their own hands and start to do things with it that they're not supposed to do it. In addition to the fact that it's somewhat inconvenient, you need a prescription for it, generally compounded, you have to be closely monitored with it, and ultimately have to get a medical evaluation. That's a lot to go through for improving your skin from an anti-aging point of view. When you have so many great alternatives that will improve fine lines and wrinkles, stimulate collagen, decrease dryness, improve pigmentation, equal to or better than what estrogen can do, topical estrogen to do. And what are those? Those are retinol, vitamin C, niacinamide, hyaluronic acid, and peptides. All of these things are readily available. They're part of the trifecta, which you all know I speak about a lot. My skincare product that includes all those important anti-aging ingredients, but you can also get them all separately. But if you have alternatives that are literally 100% safe on a systemic level, there's no risk of cancer, there's no risk of blood clots, there's no hormonal related ups and downs, moods, this, that. Why in the world would anyone choose that approach over what's been around and equally or better than topical estrogen. In addition, there's very important lifestyle factors that need to be addressed all the time. You have to be great with sun protection. You want to be on top of your diet, your nutrition, your hydration, your sleep. All the things that I've shared with you are very, very important in terms of having lovely skin. So it's not as easy as simply just doing one thing and calling it a day. You need your lifestyle, plus you need your topical aspects, and together, that's how you're going to defy skin aging. And that's the beauty of it. The one thing I have to say, surgery, there's no replacement for it when it comes to sagging. But keeping your skin young and supple and youthful looking, 100% you can handle and manage that doing the right things. That's my answer to the hype. That's my answer to the questions that are coming up all the time. Because like everything else, there's a lot of marketing, there's a lot of discussion, there's a lot of noise, and it's very hard for you as a consumer, as a potential patient, as a person who cares about addressing their anti-aging needs to figure out if something is a good choice or not. And that's really, at the end of the day, what this channel is all about. So if you haven't already done it, make sure you subscribe. Ultimately, what you want to do is choose things that have high reward, low risk. High reward, low risk. That's how you have to approach it. And part of that is based on your health. Part of that is based on your dollar and your wallet. Ultimately, like I said, I truly evaluate and think about all of these different technologies and products and concepts and all this kind of stuff. And I'm going to share my thoughts with you. So for me, it's a no-brainer. Not worth the risk, not worth the approach when you have a better alternative, a safer alternative. I'd really like to know what your thoughts are. I'd love to know if you've experienced this, tried it, used it. No doubt you probably have some positive things to say about the results with it, but I mean, you talk to the 10,000 plus trifecta subscribers that are using it on a daily basis. You also hear wonderful feedback and news about its efficacy, etc. So again, results isn't the measure of whether this should be done or not. I think it's all the other negative things, the risks that we have to put into the equation. But I'd love to hear your thoughts, and whether you agree with me, disagree with me, let's hear it. All right, my friends, I hope you enjoyed that. I hope that was valuable and helpful for you and helped answer these questions. Subscribe to this channel so you can hear more helpful insights and tips on skincare and facial aging. Subscribe to the KaramMD Journal, which is a beautiful free newsletter that gives tons of information on topics like this. All right, folks, until next time, Dr. Amir Karam.